Can you give us some tips?
Sure. Well, I'm fortunate that I have a very short walk to work. It takes me 10 minutes to get from my front door to inside my treatment room. So I take advantage of that short walk to warm up my hands while I'm going to work. So I'll do stretching for my fingers and my wrists, and I'll do rotations of all of the joints as well. And I'll also do some self-shiatsu along the thenar eminence in particular, and between the first and second metacarpals and down the thumb and so on. So yeah, we can do some. Why not? So
yes, please.
I'm just going to shift my camera down a little so you can see my hand.
Okay.
So when you're doing shiatsu, you use the pad of the thumb or finger, not the tip. And you're going to try to keep your thumb extended when you're applying pressure rather than bending it. If you're bending it like that while you're applying pressure, you're going to really tire out the tendons. Okay. Right? Whereas if you keep it extended, you're relying more on the skeletal structure. So actually, maybe I'll just stand up. Is that okay? Then you can really get
that's perfect.
my hand. So there are 3 points between the first and second metacarpal. So you're going to work proximal to distal. So you're working toward the fingers. And you're just going to gradually increase the pressure to a comfortable level. You don't want to be causing yourself any pain.
Yep.
And then slowly release. So you're holding each point for just about 4 seconds or so.
And the more tender they are, the worse the condition?
Well, possibly. Some people are more sensitive than others as well. Okay. So we have time to do more, right? We can do the whole hand. So there are 3 points between each of the metacarpals. So moving on to the points between the second and third. And again, you're working your way toward the fingers. My hand's looking a bit awkward now just because of the way I'm standing. Yeah. I could do that. You can move your hand to the other side to work on the next 2 rows. So again, it is 3 points for each row, ending with the row between the 4th and 5th metacarpals.
Some of those are a bit more tender than others for me, like the ones proximal a little bit more tender than
right. And now normally I would repeat those several times and then go on to the thumb, and there are 2 points between the metacarpal phalangeal joint and the interphalangeal joint. So you're not pressing on the joints, but you're pressing on the front and the back.
Okay.
The dorsal and volar aspect at the same time. So 2 points there, and then 1 on the nail bed. And then on the sides as well. So you're applying pressure to both sides at the same time. So again, 2 points, and then 1 on either side of the nail bed.
Hello, everybody. It's Paula Nutting, your musculoskeletal specialist, and today I've got amazing Leisa Bellmore, who's a shiatsu and massage practitioner all the way from Toronto. And I've got to say, for those people who have listened to these before, that music was beautifully mellow, because the last time that it's been and it's terrified myself and the other people that we had, especially I had John Sharkey and Joanne Avison, Lisa, and the music finished and all 3 of us, our eyes were like, what was that? Anyway, welcome aboard this platform. We are so lucky to have Leisa with us for an hour. And this platform is one where you guys can actually ask questions anytime through the chat, and Leisa will do her best to answer them. So Leisa's qualified in so many areas, including research. But what I'm going to do is, rather than me talk about Leisa's accomplishments, I'm going to hand it over to you, Leisa, and get you to tell us a little bit about yourself.
Thanks, Paula. So, yes, as Paula said, I live in Toronto, Canada. I've been a shiatsu therapist for 20 years now. and I practice Namikoshi Shiatsu. I work at a really unique integrative clinic in a hospital here. And it's a wonderful atmosphere to work in, a very collaborative atmosphere. I work with a team of biomedical and complementary practitioners. And there's a lot of respect for each other's discipline and each other's work, and a lot of collaboration. And it's a clinic specifically for artists. So
Yep.
we see a lot of people with repetitive strain injuries and overuse syndromes, as well as chronic conditions and mental health issues.
Okay, wow. That's amazing. Can I ask, just before we keep going, when you said it's a certain kind of shiatsu, is there many different forms?
There are a number of different styles, yes. And Namikoshi Shiatsu takes a slightly more Western approach than some of the others. So not focusing as much on the meridians, but
Okay.
Focusing more on points tend to be at points where there is a heightened physiological reaction in the body when working on those areas.
Okay, so it's almost working on a somatovisceral kind of format?
Yes, similar, yes.
Okay, wow. Yeah, wow. So I guess that's how you're managing to do a little bit of the, because I noticed that we were talking earlier and that you've got 3 published research papers. So you're actually, that's the kind of line that you're looking at because there's such a physiological response. Is that correct?
Mm-hmm. Yes, yeah. I think the type of shiatsu, the approach of this type of shiatsu makes it easier to do research in some ways. But it certainly makes it easier to collaborate with other healthcare practitioners who come from a very medical background.
Yeah, yeah. So who else? You said that you've got a multimodality. So you've got general practitioners in there?
We have a GP who does psychotherapy and cognitive behavioral therapy. We have a nurse practitioner. We have a physiotherapist, a chiropractor who also does acupuncture and craniosacral therapy. Sorry, 2 chiropractors who do both of those. We have a registered dietitian, a naturopathic doctor, a massage therapist, a social worker who also does psychotherapy, a psychiatrist, and myself doing shiatsu. We soon have a speech language pathologist joining us as well.
Wow, it's massive. That's amazing. Yeah, we don't see that so much over here in Australia. Well, not in Queensland anyway, but is there many of those hubs in Canada?
Unfortunately not. We're quite unique.
Yeah, wow.
It's rare to get an integrative clinic with so much diversity, and it's rare to find a clinic that addresses the healthcare needs of all artists.
Hey guys, it's Paula Nutting, your musculoskeletal specialist, and this is that awkward, cheesy kind of part of the video where I ask you a big favor. So if you want great content and lots of information, you can see down here in the little testimonials, there's free manual therapy information. There's really cool stuff on necks, shoulders, backs, hips, wrists, arms, etc., etc. I've got amazing Ask Me Anything podcasts and vodcasts that you can get free access to. If you want to get that great content, can I please ask you 3 things? 1, can you please subscribe to my channel? 2, can you hit the like button? And as they say, just smash the heck out of that like button. The more information that YouTube gets to me, the more I can give content to you. And if you can click on the bell, that will also give you timelines for when I'm actually dropping something into YouTube so that you can access it really quickly. So subscribe, like, and click on the bell, and I'm hoping to get you as much great content as I possibly can. Paula Nutting, your musculoskeletal specialist.
So there are clinics specifically for musicians or specifically for dancers, but I think we're the only one of our kind that sees anyone who works in the creative or performing arts.
Yeah, that's amazing. So what I might actually get is our fairies in background land. I might get you guys to, if Lisa can let you know what her actual, like how people in the Toronto region who are artists might be able to get in touch with to get clients and patients that might have problems. So you might have a therapist that's listening in today who lives and works in Toronto area and has a patient who's a dancer and has got issues with their feet, or a violinist who has problems with brachial plexus stuff that maybe you guys could help. So if you want to pop your clinic details in the private chat area, then
sure, I will do that.
Maybe give you a hand to put out there. So Leisa and I have known each other, just while she's doing this, Leisa and I have known each other for, probably 8 years or more now. I'm trying to remember. We first met up when you were the incoming or outgoing president of the National Health Practitioners of Canada.
So I think it must have been 2008.
Yeah.
It's been a while.
It's like 14 years. It's 13 years. Amazing. And we have done a lot of collaborative work with the Australian Association of Massage Therapists, which is now renamed Massage and Myotherapy Australia, where we were trying to get a streamlined integration between Canadians and Australians to be able to move, increase their transportability. We have been involved for ages, and I was lucky enough to get a small treatment in Hollyhock from you, a shiatsu treatment. So I firsthand had amazing knowledge on how it can actually make someone feel. So thank you for that. Tell us, the main reason that we've got you here is that we want to try to help practitioners stay longer and healthier in the industry. Can you tell us a little bit about how that works?
Well, I mean, just like performing artists and athletes, we overuse some muscles, we underuse others, right? So if we're not caring for our body and our minds as well, it can really be detrimental to our career, right? We can end up with repetitive strain injuries, overuse syndromes, and even just practicing a few minutes a day can make a huge difference. And if we want to do our best to help our patients, we really have to be feeling our best as well.
Yeah, I get that analogy of put your mask on first before you put the mask on for your children in an airplane, if we ever get on an airplane again.
It will happen.
Yeah. So primarily hands or necks and shoulders, how does it work?
Yeah, when I teach workshops on this, I address neck and shoulders as well as arms and hands. I mean, the hands are the more common place to experience an injury. There was some research done on manual therapists' injuries, and I think the study looked at chiropractors and massage therapists and physical therapists, and they found the most common injuries were in the thumb. So
that makes sense.
If that study had included shiatsu therapists, because we use primarily our thumbs to apply pressure, I'm sure the percentage of injuries in the thumb would have been much higher still.
Yeah, well, yeah. And you do, and I've had Thai massage, and they tend to use the flats, the hand more than thumbs. But yeah, you were doing lots of. Is it you going through the ashi points, or vaguely remember that you actually really point specific along the body?
Exactly. And some styles of shiatsu use the elbow, but I don't. I only use my hands, and sometimes the heel of the hand as well, but primarily the thumbs.
Yeah. So can you give us some tips?
Sure. Well, I'm fortunate that I have a very short walk to work. It takes me 10 minutes to get from my front door to inside my treatment room. So I take advantage of that short walk to warm up my hands while I'm going to work. So I'll do stretching for my fingers and my wrists, and I'll do rotations of all of the joints as well. And I'll also do some self-shiatsu along the thenar eminence in particular, and between the first and second metacarpals and down the thumb and so on. So yeah, we can do some. Why not? So
Yes, please.
I'm just going to shift my camera down a little so you can see my hand.
Okay.
So when you're doing shiatsu, you use the pad of the thumb or finger, not the tip. And you're going to try to keep your thumb extended when you're applying pressure rather than bending it. If you're bending it like that while you're applying pressure, you're going to really tire out the tendons.
Okay.
Right? Whereas if you keep it extended, you're relying more on the skeletal structure. So actually, maybe I'll just stand up. Is that okay? Then you can really get
that's perfect.
my hand. So there are 3 points between the first and second metacarpal. So you're going to work proximal to distal. So you're working toward the fingers. And you're just going to gradually increase the pressure to a comfortable level. You don't want to be causing yourself any pain.
Yep.
And then slowly release. So you're holding each point for just about 4 seconds or so.
And the more tender they are, the worse the condition?
Well, possibly. Some people are more sensitive than others as well.
Okay.
So we have time to do more, right? We can do the whole hand. So there are 3 points between each of the metacarpals. So moving on to the points between the second and third. And again, you're working your way toward the fingers. My hand's looking a bit awkward now just because of the way I'm standing.
Yeah.
I could do that. You can move your hand to the other side to work on the next 2 rows. So again, it is 3 points for each row, ending with the row between the 4th and 5th metacarpals.
Some of those are a bit more tender than others for me, like the ones proximal a little bit more tender than
right. And now normally I would repeat those several times and then go on to the thumb, and there are 2 points between the metacarpal phalangeal joint and the interphalangeal joint. So you're not pressing on the joints, but you're pressing on the front and the back.
Okay.
The dorsal and volar aspect at the same time. So 2 points there, and then 1 on the nail bed. And then on the sides as well. So you're applying pressure to both sides at the same time. So again, 2 points, and then 1 on either side of the nail bed. And then with the fingers, of course, because we have an extra phalange, then we're doing 2 points between the metacarpal phalangeal and the interphalangeal joint, and then 1 point, and then 1 point on the nail bed.
And these all represent areas for the actual finger's health, but is there also a visceral component to this too, or is it?
Well, I think, this is just my theory, I think because we have so many sense receptors on our hands, it has a really profound effect on the nervous system. So it can be really helpful at just calming us down.
Okay.
And the research studies that I did, the 3 that have been published so far, used this hand self-shiatsu technique. So I'm going to put in the private chat, I'm going to also put in a link to the video that we used for our 3rd study. We were fortunate and got a big funding grant. Actually, we got a grant for our 2nd study and created this video to use for our participants to teach them the technique. And then for our 3rd study, we got a bigger grant and we're able to create a website and an app. So,
oh my gosh, an actual app as well.
So you can go to this website and can I talk and type at the same time?
Yeah, it's really tricky, isn't it?
The website is, all the resources are free on it, so you can suggest this to your patients as well.
Perfect.
And it's fabulous for any issues with the hand. It's also, our studies looked at improving people's sleep.
So working on this could help people with their sleep for the neurological.
Yes.
Oh, wow.
Yeah.
Okay.
We
Cool.
found We had subjective improvements in all of our studies. People said they were falling asleep faster and waking less often and felt more restored at the end of in the morning when they woke up.
I wonder if that, like there's so many women who are, I'm going to say 55 and over that wake up in the middle of the night and then cannot go back to sleep.
Mm-hmm.
We could do this kind of, like that would be a tip to, because you kind of think, am I waking myself up by doing something? But I suppose you can actually be doing that whilst your eyes are closed. And
definitely. And we sort of hypothesized that part of why it worked was that it required concentration, right? People had to think about what they were doing, which means they're not ruminating about anything they're worrying about, or everything they have to do the next day. It's taking them away from that, and they're focusing on just doing self-shiatsu.
Yeah, that's amazing, isn't it? I'm not sure if there's how many of people are actually out there and listening, but if you've got any questions for yourself or for any of your patients and clients that you're treating, pop it into the chat box for us so that we can actually drag some of this amazing knowledge out of Lisa's brain. Lisa, what about things like specific conditions, so like that goose's fingers or clicking thumbs or specific stuff?
This can all be wonderful for that. You want to be gentle if there's any condition that's causing a lot of pain, or if you've got someone with severe osteoarthritis, for example, you want to be very gentle. But even gentle pressure does have an effect. You see, it will loosen things up. It can help to improve the range of motion and the flexibility, and just help with the functioning of the muscles and the nerves as well.
Yeah. I love that we're talking about that sensory input, like the actual neural part, because the nervous system seems to be where our industries are now traveling. Do you agree?
I think so. Mm-hmm.
Like it was all just, deep, heavy, compressive massage. Then it was like sports massage was coined because it was just that get in and work really hard. And then that kind of immigrated to more of a fascial kind of treatment. They'll be doing that flushing and mobilizing in the sports industry. And now we're looking at the nervous system and how to accelerate the neural pathways to improve sports performance. But it's good to see that we're doing it in a patient setting as well with the nervous system.
Mm-hmm. And it's a fascinating area, right?
Yeah.
There's so much we don't completely understand about the nervous system. I think it's a fabulous area to explore, and just it's amazing.
And the thing that we do know about the nervous system is it's fast.
Mm-hmm.
So results are quick. And actually just feeling this hand now to this hand, like this is the one that I did the work, it feels like it's tingling and open, and like it feels markedly different to the one that I didn't work on. In some kind of subjective, I can't say how, but it subjectively feels different.
And this is something that I do before, if I have a busy day of doing shiatsu, which seems to be what most of them are now, I always work on my hands beforehand. So while I'm walking, I'll be doing some of this, or in the days when I used to go to the Toronto Symphony and work on the musicians there once a week, and I would always on my streetcar ride there, my tram ride, I'd be doing self-shiatsu on my hands to warm them up and get them feeling good. It made a huge difference.
Is there any other areas that you would, like, we talk about hands, but is there something for the neck or shoulders, people with upper traps that would be value?
Sure. Personally, I love doing work on the neck, but especially in the suboccipital region is a really great area to work. And along the top of the shoulders, the suprascapular area. So we could certainly do that. I'll have to turn around to do the suboccipital, but that's fine.
That's right.
The easiest way, if you're doing it on yourself, is to link your hands together and place them at the crown of your head, and then use both thumbs at once to apply pressure.
Oh, okay, yep.
Because our thumbs are so much stronger than our fingers. If you have a mobility issue in your shoulder, you certainly can use your fingers instead, but I find the thumbs are so super strong that why not? So I'm just going to turn around. I think I have enough length in my mic to do that.
I have made this a bit of a trick today. Sorry about that.
So now, can you see my head okay? Am I still in the shot?
Yeah, you're still in shot.
Awesome. So there are 3 points on each side just below the occiput. So you're right up at the top of the neck. And the first point, if you feel your mastoid process, the bony bump just behind the ear, you go directly below that and just a tiny bit back. So that's where your first point is. And you're pressing in and just up slightly.
Oh, wow. Okay.
And try to keep your shoulders relaxed and down while you do this. Yeah, it's a good spot.
And 4 seconds, or is it longer with these ones?
If it's tight and tender, then hold it for longer for sure. But again, making sure that the pressure is comfortable.
Yeah.
And these points are very close together. So the next one is right beside that.
This feels amazing.
It's good, isn't it? I love these points. They're great for headaches too and migraines.
Okay.
So the third point is on either side of the spine. So you're right on the upper traps tendon. If you move your head, you can feel it.
Yeah, got him. And it's handy with the fingers interlaced like that because it takes some of the pressure off your shoulders.
Mm-hmm.
Yeah. I had my fingers apart. Now I'm realizing it's much better having them linked.
Mm-hmm. Just gives you a little more strength, right?
Yeah.
You don't have to use quite as much force.
And there's that connective chain, closed chain behavior. So that does make sense in my sports brain. Wow, that feels really, really good.
And you might notice one side is a little more tender than the other. If it is, you can certainly do more repetitions of that.
Yep.
Get it feeling good.
Mm-hmm. So that's a really good tip for therapists because we spend so much time, and our patients, like everyone spends their whole time, because of our defensive society right now is that we naturally kind of come up to protect.
Mm-hmm.
So not only in the old days of just people driving or office workers, etc., that they end up with shoulders elevated.
Oh yeah.
But now with the pandemic and everything that's like the components above and beyond, we're actually really having a lot of problems with patients that we see up through here.
Definitely, and with people working from home as well, they're on their computers all day. People are generally spending more time working than they were when they were on site. This is apparently. So you're on the computer. You start out with wonderful posture, and then slowly your head comes forward, and your shoulders go up and forward, and you end up like this.
So exactly, and I don't know if there are, but I wouldn't be surprised if there's shiatsu points along the sternalis or the sternum area, because there's a lot of people that we get like that linking with the neck and shoulders that have also got a wicked band that's down here that I find working through that helps with shoulder position. So
for sure, there are points straight down the sternum. There are points between the ribs in the intercostal area too, and in the delta pectoral groove.
Yeah.
And of course, stretching is another thing that's really important for us.
Yeah, because not enough people, I try to go to Pilates 3 or 4 mornings a week, and they we try to throw in some stretching, but there's a lot of people that they once they finish the hard yakka part of it, they take off before actually getting into that value out at the end. And you see that all the time in gyms. People will do heavy load exercise, so the muscles are contracted, and then leave for work. They won't actually give a little bit of time to get the joints sitting in their natural pathological end ranges again. So we have this hot debate whether stretching is applicable or not, but I think getting through end range of the joints is really important. Mm-hmm. It'd be nice to rename stretching something else. I'm just going to shut this door. There's someone doing a whippersnipper outside. Hold that thought.
And it's the other thing you have to remember is it's great that you go to Pilates 3 or 4 times a week. That's fantastic. But we don't necessarily need to spend, carve out a huge chunk of our day for self-care, right? Just a few minutes makes a difference. And it's the same for our patients. And when you think about it, when we're working on someone, when we're doing massage or shiatsu, our arms are forward. We're often leaning over. So we have to do things to open this up again. And something as simple as, after you finish with your client and you strip the linens from your table, throw down a rolled up towel and lie supine with it along your spine. Just let that open up. Do that for, it's nice and simple. It doesn't take any effort.
Just
exactly. Lying like that for a couple minutes can open this up again.
Yeah, and it's crazy, isn't it? I quite often will get, where you're doing wall angels, just trying to get the fingers, or leaning into a door frame and walking the fingers up, so you're actually feeling like you're getting some really good movement pattern. I love, Carl has just said that the importance of stretching reminds him of Dr. Gil. Like, I love Gil Headley's in general, but his fuzz speech, and I'd love to know what that fuzz speech was. Carl, if you want to type back in there a little bit more about it, just because that sounds like it's a teaser. It's got me going.
I'm going to have to look that up now.
Yeah, exactly. So we're talking also about strategies to help for our patients in helping them with their engaging longer lasting treatments with shiatsu and or massage. How do you integrate this to keep, like we've worked on ourselves, what about our patients?
Well, it's really important to consider each patient's capacity for self-care. So, you'll have some patients who they'll take anything on board. Anything you suggest, they will grab it and run with it. and that's great. But most of them will not be there, right? And there are a lot, especially if you've got people who are struggling with chronic conditions or with mental health conditions. It can be, they might be a bit more reticent to start doing some self-care, right? So it's important to start really small. Just give them one simple little thing to do and encourage them to do that. And when I always ask my patients about their self-care. If there's anything they're doing that is positive, encourage that. Tell them that's great that you're doing that and spending that time on yourself. Because I think people need to hear that.
Yeah, we take it for granted, but that might be a big step in somebody's day to actually spend 3 minutes of mindful breathing. Especially if you have someone, with mental health issues who may have self-esteem issues. The idea of spending time on themselves is very foreign. So, we have to really encourage that. And even if it's something as simple as, they try to spend 10 minutes meditating twice a week, that's great. They're not going to start adding more unless they get some encouragement and positive feedback about it, right? Yeah, that's a good point. We don't really look at what they're currently doing and supporting them there. And that's the problem. We end up giving, we don't, but there are some in our industries, in the healthcare industry, that overload people with too much homework. And our lifestyle just doesn't afford more exercise, more homework, really. It
has to be things that are easy enough for them to fit into their routine and things that they will see a benefit from, right? And the same self-care tips aren't going to work for everyone. So that's important too, to emphasize for them that I will sometimes give people a PDF with a number of self-care tips for example, stress management or to help with sleep. And I will always tell them, try different aspects of this on different days, see what resonates with you, see what you feel works best, and then go with that. You don't have to spend an hour doing self-shiatsu. If you want to, that's great, but... Yeah, and that's exactly it, isn't it? I remember when we were talking to people that might have had pelvic floor issues, whether it's
during pregnancy or postpartum or post-surgical or anything, it's when you're at the lights, draw up your pelvic floor. So we try to always link an action with something that they're currently doing, because then that action's already a habit. I'm already cleaning my teeth. So why don't you try cleaning your teeth with your other hand every other day? But just be mindful you'll take off the internal mucosa if you go a little bit too hard. So just be a little cautious with that. Or try to use the knife in your right hand and left hand and your fork in your right hand, just once every now and then to change the neuroplasticity. Because sometimes people get into that depressed rut, and it's just because we're in those same tragic old neural pathways and changing up. The volume of things to make people laugh I think is super important. I've had the amount of times I've had patients that I've said, your homework every night when you get home, I want you, because I know you've got a big hallway, we'll unpack where they've got, what the house is. I want you to skip, like skipping, not skipping rope skipping, but I want you to skip up and down 3 times.
Excellent.
It's impossible not to laugh or not to smile when you're skipping. Like if you just try it brings out the child in you. So it actually, all of those positive endorphins, we're just kicking into some self-love, a bit of oxytocin. There's some really clever things out there to do that are fun and easy.
For sure. And that's all part of self-care, right? It doesn't have to necessarily be physical things that we're doing to improve our health. It can be just simply carving out a little bit of time for ourselves to do something we enjoy, whether it's going for a walk with our dog or, reading a bit of a book just for fun, or whatever, hanging out with a friend and having coffee. That's all self-care. It's just a different aspect of it, but it's all important.
Yeah, because we don't think about mental health as much as we probably should, but mental health care is exactly that. So Carl said back saying that that Gil talks about fashion work, and he has always been a great advocate for cadaver work. I remember seeing him in, I think it was Phoenix, where we were at the AMTA conference, and he was speaking there, or that's Cincinnati was too. Tissue melts via movement, stretching and range of movement. And when it's neglected, it hardens and removes the range of movement. So that's a better way to talk about what stretching actually is versus elongating a muscle, because when you put it under like if you do a hamstring stretch, if you talk to John Sharkey, the second you put yourself into a hamstring stretch, you're actually creating an isometric contraction or an eccentric contraction of the muscle, because it's guarding, the tendons are guarding it with the Golgi tendon organs. So we're actually contracting, not relaxing. But looking at talking about melting via movement is beautiful.
I like that.
Yeah. Thanks, Paul. It's good to see Jeffrey here. Jeff's one of our amazing old 6-figure therapists I've known for a while. He's a chiropractor down in Melbourne. But all this stuff will work for multimodalities, so you can actually be about to go in to see your chiropractor and do some work on your hands. What other tips have you got for us to help our patients?
Well, I've created a number of PDFs for patients on self-care for various health conditions, various issues. And I find it's helpful to have something on paper that you can give them, either a paper copy or an electronic PDF, but having it in print with simple illustrations makes a huge difference, right? Rather than just verbally telling them, because they might not remember it correctly, especially if they have cognitive issues. And when you think about people with chronic pain, for example, or mental health issues or PTSD or post-concussion syndrome, they can all have difficulty remembering things. So, having something written down in plain language, not in medical terms, just plain language, simple illustrations, because some people are visual learners. It makes a huge difference. And it's astounding that people are people that I suggest stuff to, and I ask them, would you like me to print you off or email you this? And they're so appreciative of it. You know, they're just, that's amazing. Yes. And if they have it, you know, they have a copy of it, they're more inclined to do it.
Exactly. So everyone leaves my clinic with one of these.
Excellent.
And I use like Nico's, and so they know yellow might be the first one. So and draw yellow. This is where I want you to do yellow, then green, then blue, then pink, or whatever. So they always get homework. And the other thing that I find is really good for your patients, because no one remembers anything verbally. You just don't work. Yeah, videos. Exactly, Jefferson, osteo. So videos work, and I grab their camera and go, all right, these are the positions that I want you to do, and I'll get them to be in, like, it might be in a glute stretch, a figure of four stretch seated, and I go, just sit there, click, or I might ask them to do a movement and we'll video it so it's on their phone. So it kind of covers the privacy issue because it's on their device, not my device, and it frees up anything that, you know, like that fear of someone taking personal property. So like that's a cool way to do it. And
that's a great idea.
It's so easy. It's like so easy. So, and I think that those, having a number of PDFs, we could possibly share those. Sorry, I'm reading through the comments at the same time. We could possibly share some of those PDFs because they're probably on your page as well.
Are
they C-Bot Labs?
There is the one on hand Self-shiatsu is there. Yes.
Yeah. Okay.
So, you can get an idea of what they look like. They're very, very plain language, simple, easy to understand. And the other thing I do with patients is I do self-shiatsu training sessions. So, I've been doing those in clinic for a while now, and instead of booking a hands-on shiatsu, they will book one of these sessions if they want to learn some self-care. So I'll cover not only some self-shiatsu, but maybe a couple of acupressure points and some stretching, any other self-care that would be appropriate for their specific needs. So they'll communicate with me in advance about what they want to focus on, and then if I don't have something together already, I'll put something together for them and talk them through doing it. So I'll demonstrate on them so they can get an idea of how it's supposed to feel, and then I'll talk them through it. And I will sometimes have them demonstrate it on me, so I know that they've got it. They've grasped it well. And that was something that I also did during the pandemic when our clinic was closed when we were in lockdown. I did them virtually instead.
Yep. So similar to this, get them into their space, and then you can teach. It's amazing how much you can actually teach a tactile industry via this format. Because we're visual learners. So if you can see that I'm doing that, and we give them really clever bony landmarks to work off.
Yes.
You can actually do that. We get a lot of patients in with lower back pain. Is there some magic that we can offer people listening today on ways to help ourselves or our patients with lower back?
Yeah, I'm assuming that most of our audience is probably familiar with stretches for that area. So, but in terms of shiatsu, yes, there are points in the lumbar area and through the QL and across just above the iliac crest as well, and on the sacrum that can be fabulous for that. So we can do the ones in the lumbar area if you want. Yeah. Start with that. See where we go time-wise. I have to stand up and turn around, and I don't have much room in my tiny office. Okay. Unfortunately, this is quite dark. I'm not sure if you can...
No, I can actually see you really well.
Okay, great. So there are 5 points in the lumbar region. So you're going to be pressing just beside the spine to the, laterally from the spine. And your first point is just about where the lower ribs are, right below that. It's easiest when you're doing this on yourself to do both sides at once using your thumbs. If you find that awkward at all, you can reach around this way if that's easier, but personally, I just prefer using the thumbs. So again, you're going to gradually increase the pressure, and you're aiming for it to be not quite perpendicular. You're pressing just ever so slightly in toward the spine.
Mm-hmm.
And slowly release, and you're working your way down toward the iliac crest.
So how many? There's 5 points, you said?
There are 5 points, yes.
I'm guessing everybody who's listening into this is all standing up and doing exactly what we are doing now.
Yeah, you can do them seated as well. These are also great for sciatic pain.
Oh, really? Okay.
Mm-hmm. Yeah, I need to work on this a bit more.
You get one that's nastier than the other, yeah.
Yeah, definitely. Too much sitting today.
It's still early for us.
Then there are 3 points that are above the iliac crest here. So you're pressing on the soft tissue, and you're starting with that last point in the lumbar region, closest to the spine, and then you're working laterally from there. So you're just following the curve of the iliac crest.
Yeah, they're good.
They are, aren't they?
And it's funny because the amount of patients that will say to me, oh, I'm always rubbing this area, so there's got to be an intuitive knowledge that says pressing on this area will make me feel better. Oh, what's going on? Did you just hear that thunder?
I did. That was amazing.
Yeah. That's another big storm coming through up here.
Wow. So there are also 3 points on either side of the sacrum, if you want to do those as well. So your first is, these are a little more awkward to get at because you have to really bring your arms back, but you're working superior to inferior. So your first point is just where the first posterior sacral foramen is. You can probably feel that little divot on either side.
Yep. So we're medial to the PSISs, yeah?
Mm-hmm. I think we had some thunder here too.
That's amazing. Oh, actually, I feel like I've got more lordotic, like the capacity to do more tilt.
Aha.
With that. Yeah. So is that a common feedback from people that you feel like better?
Yeah, definitely.
Sitting taller. Well, and I was going to have a massage from somebody. I don't need to anymore because
do it anyway.
I've done my self-help. That's amazing.
Yeah.
So any other questions, guys? Please put things down in there for us so that Lisa might be able to help.
I'm glad people think this will be helpful. It's great. And yes, it is perfect for people who sit all day or who do the opposite and are standing all day.
Yeah, exactly. Because we end up with a lot of back pain. People who do waiting. I see a lot of people in here that their glutes have turned off. They're inhibited because of just that long-term standing and not actually doing a lot with the glute muscles. At least if you're an office worker, you sit to stand more often.
Yes. And now with standing desks as well, that people can adjust. I'm lucky at the clinic I have a desk that adjusts to standing height, so I don't necessarily need to sit to do my treatment notes.
Oh wow! I actually quite love the thunder. I love the fact that in our industry we're sitting taking notes and then we're standing treating. Although you're floor based. Do you floor based the shiatsu? Or
I don't. Partly because I work in a hospital, I have to work on a massage table. And partly, I think for some patients, it's a more comfortable, more acceptable way to receive the treatment. I think especially for people who have who are new to manual therapy, the idea of, lying down on a futon on the floor is not as, it just doesn't seem quite as accessible as lying on a massage table. And for people with mobility issues, of course, it's difficult to get up and down. But as a therapist, it's easier on the body to work on a massage table. I just keep it at a very low height so that I can use my body weight to apply pressure. That's one of the main principles of applying shiatsu, is that you're not pushing with your hands, you're using your body weight to apply the pressure. So you're not, it's not pushing.
So and that's where the origin of being on a futon is, because you can apply body weight in that fashion. Yeah, okay, that makes sense. I find that the high-low table was the best thing that was ever invented, so that the electronic table, so you can bring it up and down. And we should always be mindful of looking after ourselves first.
Definitely.
So no, I totally get that. Christine's just asked, what can you do for someone who experiences pain around the wrist area? Hand and wrist?
Well, certainly the self-shiatsu on the hand and fingers, I would highly recommend that. But also the wrist itself, there are points. I tend to add extra points in just because
you can.
So you working on the volar side, we'll just do this. That doesn't work. There we go. I'll turn this way. So there are a number of shiatsu points straight down the forearm. So there are 3 rows of 8 points, but certainly focusing on the ones closest to the wrist. So working on the radial side first, just doing 3 points so that your third one is just above the wrist crease there.
Oh, so you're starting at the top and going towards the thumb. Yep.
And then 3 points down the median line as well. Again, ending right at the wrist crease. And then 3 points along the ulnar. And then you can certainly repeat the ones across the wrist crease. And do those several times.
So I've got a lady who came to see me this week who's got a ulnar neural issues now. So I know it doesn't go through a reticulum, so this could be helpful for her too, yeah?
For sure, definitely. And then on the dorsal side, there is just 1 row of 8 points all the way down the forearm, but you can certainly, again, add more. And again, just do 3 rows of 3 points just superior to the wrist, ending at the wrist crease.
Yeah, nice.
Yeah.
So I hope that helps, Christine. It's kind of like I've had a radial osteotomy, so I've got a little plate in there, and that actually feels quite nice doing that. In that space.
And again, just doing wrist rotations, and there's a little stretch for the hand that I really like. If you wrap your thumb and your fingers around the back of the hand, just do a sort of alternating squeezing motion. It just loosens everything up. It feels quite lovely. And then you can turn your hand over, and I have to make sure you can see my hand here. So you're going to take your one hand and put it beneath the other. You're going to slide it's really hard to get this in the frame. You're going to slide your thumb and your index finger, your thumb and your pinky above the other ones, so that you pull your thumb and pinky back while you push against the back of your hand.
Oh, okay. Yeah. So we're kind of pulling that back and pulling that back.
Exactly. Yes, and pushing up, and it just will open the hand up in a lovely way. Feels nicer when someone else does it for you.
That feels good. Wow. And I love that people are now asking questions. That's cool. And this is a really good point. Offer some points on the face for energizing the muscles of expression, because people have been hiding under masks the whole time. That's a really good point, because that is actually, you feel quite horrendous after a while, especially if you've got these. Come on, these guys, which have got very little like there's very little give in there, so your face is always kind of compressed. I've got a pile of them for patients in my clinic, so if anyone forgets to bring theirs, I've got some for them. But yeah, what can we do for the face?
Oh, there are comprehensive points all over the face and the head, and I love working on these areas. It's funny, when I was studying, I found it was the hardest. The top of the head especially was the hardest area to really get a feel for, to read. It was hard to gauge how the patient's body was reacting. And now I find, it took several years of working on it, but it's amazing. I can tell as soon as I touch someone's head if they've had a headache or a migraine recently. It feels different, and it's astounding. And I love working on the head and the face. So there are, let's see, where should we start? There's so many on the face.
Tired eyes, because I think a lot of people have tired eyes from working too much on computers.
Sure. So there are 4 points in the supraorbital area and 4 in the infraorbital. So we're going to start with the infra. And with these, instead of using your thumb, you'll use the pad of your finger. Mm-hmm. You can, if you want, you can double up your fingers like this so that it's a bit stronger, but keep in mind the tissue here is quite delicate. So you're starting just, you're along the inferior orbital margin there, and you're starting at the medial aspect and working your way lateral. And again, just hold each point for 4 or 5 seconds and slowly release.
If someone comes on and they're just come in right now, they're like, what the hell is that?
So you're slowly working your way over. So your last point is just more or less beneath the corner of the eye, parallel to the corner of the eye.
Nice.
And then 4 points above along the supraorbital ridge. So just below the brow line. If you're at a desk like I am, you can rest your elbows on it.
Oh, that's a good idea.
And actually, Paula, it's easier if you put your thumbs on the side of your face, just for to give yourself a bit of support and stability. Mm-hmm.
Yep. Yeah, that makes that a lot easier. I was thinking about bringing my thumbs up and working through there, but that's a far better position.
Uh-huh. So again, you could repeat these several times, and then you'd already have glasses off. If you're wearing contact lenses, be very gentle when you do this. But with your eyes closed, you're going to take the heel of your palm and just apply gentle but firm pressure directly to the eyes. This is wonderful for eye fatigue, and it's very relaxing, very calming. Causes a reflex action in the body that makes your blood pressure drop just slightly and only temporarily. But it's a great way if you're feeling really stressed to just instantly bring yourself down a little bit.
Yeah, that's clever. And I suppose if you add that with breath work, so like and then just breathing diaphragmatically to add that little bit extra. Nice work. I'm feeling very zen.
Yeah, that one always does it for me. I just feel calm and grounded after I do it. Really lovely.
So you look at that as if you've got someone, as a patient who has got some stress or anxiety.
Mm-hmm.
How easy is that?
Exactly. You hold it for about 30 up to 60 seconds. That's it. It doesn't take any longer. It's probably the best tip you can give someone with stress and anxiety. It's the best self-care tip for them.
Yeah, that's amazing.
And along with some breathing, like you said.
Yeah, and that's right, because we want to utilize the relaxation response wherever we possibly can, because if anyone's in that flight and fright area, we really want to get them out of that, because you don't get mental clarity in that space. You don't have full motor recruitment in that space. So we want to actually, that's my bag, is get you into the parasympathetic flow as quickly and for as long as you possibly can in your day, because that's where the genius moments come from. It's never going to be in that space of anxious fight and flight.
Mm-hmm. And
so
the one really wonderful thing about self-care, especially for people with chronic conditions, they often feel a lack of control, right? Research shows that they feel a lack of control over their health, over their life in general. And teaching people self-care, and again, research demonstrates this, teaching people self-care increases their feelings of control and mastery. So this is really important for people with chronic conditions, that especially ones that involve chronic pain and that have been, persistent. And especially important for people with mental health issues as well, right? If you can get them to feel like they have a bit more control and mastery over their lives, that's really, really valuable. So empowering.
Well, they are such powerful words. Like really, that's it, isn't it? Because you hold a little bit of your own space in the madness that's around. It just starts from one spot, doesn't it?
Indeed.
Tell me, you've got 3 published papers and 1 in review. We've got probably about 3 or 4 minutes left. I'd love to know I'd love to know the 1 in review. But
well,
I want to know this as well.
The 1 in review is the abbreviated version of my Master of Science dissertation, which I completed recently, last year. And so it looked at a self-care intervention as well. It was about the experience of shiatsu for care partners and persons living with dementia. So It was a small qualitative study, just a pilot study. But in it, I taught a workshop with care partners of persons living with dementia, and I taught them how to do self-shiatsu for stress management, just a short little 10-minute routine. And then I taught them how to do a really simplified version of a shiatsu on the shoulder, arm, and hand for their loved one.
Oh, gorgeous.
Again, just a very short 10-minute routine. And then I did interviews with them at 2 follow-up periods to see what their impressions were of it. And I wanted to see if it had any impact on the quality of their relationship, if using touch in a structured way like this made any difference for them. And I had really mixed results. I had 2 people who found self-shiatsu really beneficial, and 1 who was quite neutral about it, and 1 who disliked it. Although that person told me in the interviews that she disliked massage in general and didn't like being touched. And so, and when they used it with their partners, 2 of the partners were resistant to receiving it. So, of course, their care partner stopped, and which is what I told them, instructed them if they ran into that problem. One of them found it was a neutral experience, and the other one found it was a really lovely way of spending time together, and she felt it created a close connection.
Isn't that interesting? So it offers for more, I suppose, working at the people who aren't touch people. Like if you and we know many people go, oh God, I hate being massaged. Don't come near me with those hands there. You're certainly not going to put them into a study, but you don't always know that before you start, because I suppose if you're the first group you're looking at are the ones in dementia, and then their partners versus going for the partners first.
Yeah.
And you don't know if the dementia like or don't like massage, because dementia is a state where it's not really what they were in previous life anyway. So,
it's with some people, yeah, it's interesting. And this whole study, it originally started with personal experience of working with my father, and he lived with Alzheimer's for 12 years. And I use shiatsu with him regularly, just not full treatments, but just doing short little, 10 or 15 minutes whenever, not every time I saw him, but as frequently as I could. And I found as the disease progressed and, conversation became, very different. It was, we couldn't have a real conversation. It was for me, a really wonderful way to connect and interact with him. And he was much more engaged when I did it with him. He would, he'd tell me how good it felt repeatedly. He'd smile and make a lot of eye contact and, make appreciative noises. Sometimes he'd reach out and try to start working on one of my arms. It was a lovely way for us to connect without the need for words.
Right? Yeah, because really, how do we start? We don't come out of the womb talking.
Exactly. Touch is the first experience that the first sense that we experience, right? And it stays with us the longest. So it's a wonderful way to, I think, maintain engagement and connection with people who are not able to communicate and relate in quite the same ways anymore.
Yeah. We had, just on closing, my partner lost both his parents within 16 days of each other last month. 93 and 91 years of age. Both actually ended up in the same hospital, in the same ward, in the same room. So it was just like 20 odd days of, oh my God, what the hell is happening? But the touch component was so, because we are touch people. Most people most people don't, like, they don't like to touch. They feel like it's like an invasion in privacy. But I know that when there was times that I was with Brian and Daphne, just with the two of us, I would massage the feet, massage the hands, give the face a wash. Things that there was an immediate change in their response, their breathing, their touch, their facial movements, eye movements. And like anybody out there who is dealing with someone who is leaving, transitioning, put your hands on. They don't have to be busy. They can just be still. But touch is such an important part of giving them the grace that you're present with them and allowing them the grace of transitioning at their own pace. But yeah, wow, it was one of the most wonderful things I could have received from both of them.
Yeah. Well, there's an interaction, right? When we're touching someone, when we're giving touch, we're also receiving their touch, right? Yeah. There's a transformative nature, and it's an amazing, powerful, wonderful thing.
Yeah. What a great way to finish the conversation. Touch is such a place that we should be, and everyone who's listening and on this hour have been involved in touch. In like this is our thing. Leisa, anything else? Any parting info? You've got workshops.
I do have some scheduled for Europe next year. I will be doing a webinar in December this year on self-care for therapists, conveniently. Self-care to promote career longevity. So Care for the Carer, it's called. So I will have details of that on my Facebook page.
Okay.
And it is for the Co-School for Shiatsu in Zurich, but anyone from anywhere in the world can join us.
Yeah. If you can whack that into the private chat section, and then my Aubrey can put that into the links for the Ask Me Anythings that we've got here, so that they can be in the comments below and people can access that.
Awesome.
If that's at all possible.
Just checking the date. I don't remember when I booked it. There I did. Thursday, December 9th. There we go.
Nice. Okay, so people who are listening, that will be Friday for us. For
at
Europe?
I think it's at 1:00 my time.
So what do we now? So it'll be
p.m. in Europe.
Okay, so you'll be setting your alarms, ladies and gentlemen, in Australia. But that's okay, because it would be worth listening to. So that's pretty amazing. Thank you for all those people that have made comments over here in the comment section. It's good to see you, Jeffrey. I hope that you guys are getting out and about. I think you can start treating down in Victoria. They've been in lockdown with 2,000, like near 2,000 cases a day over there. And thank you, Carl, for the comments with Gil Headley's The Fuzz speech. I guess that Lisa and I are both going to look that up. I know I definitely am. And I might even see if I can get him on board. We don't have anyone scheduled for next month at this stage, but I do have amazing chiropractor and teacher Michael Copland coming in January 21, I think it is, 22 for me, 21 for him. So that will be something, again, about outcomes for our patients, not actually touch techniques, but more about how we can empower them for clinical practice, like how they can feel better. So it's more of a biopsychosocial conversation. So look out for that one coming up in January. And if I can find maybe Gil or someone between now and then, I'll see if he's interested in jumping on board. But Lisa, thank you. Thank you again. It's always good to see you. You always have so much great information for everybody. And we wish you well with all of your ongoing research and your practice.
Thank you. And thanks so much, everyone, for joining us and for participating.
Yeah, excellent. All right. Have a great day for the rest of you guys. Enjoy. I have pain on my lower back sciatica and slip disc. Yes, 2 discs. Any tips to strengthen my lower back, please?
It's not for strengthening, but those self-shiatsu points we did in the lumbar region would be great, and across the iliac crest.
Yeah.
That would be helpful.
Ouch. Good luck with that.
Strengthening your core, but being mindful and careful about how you go about that.
Nicely said. Yeah, exactly. And follow whatever your medical practitioner is. Yeah, stick with that pathway as well. There you are. December 9th, Care for the Carer, Self-Care for the Carer Longevity Webinar with the Koshul Fu Shiatsu in Zurich. So jump on board for that. Grab that link, everybody. I'm going to let Lisa go home, or finish off, walk outside her clinical space and have dinner, whatever that looks like. And I'm going to get my clinic ready for the day's practice. Thank you, everybody.
Thanks, everyone. Bye.
See ya.